President Obama and his administration are facing a lot of pressure over the scandal of the Department of Veteran Affairs.
Anybody found to have manipulated or falsified records at VA facilities has to be held accountable. The Inspector General at the VA has launched investigations into the Phoenix VA and other facilities. Our veterans deserve to know the facts. Their families deserve to know the facts. Once we know the facts, I assure you, if there is misconduct, it will be punished.
My next guest is a physician who's worked at 4 VA hospitals and has witnessed some of the mistreatment of veterans. Joining me now, Dr. Jean Greenlees. Dr. Greenlees, you have worked at a number of VA facilities. When you heard these stories, the ones coming out of Phoenix and other VA hospitals, were you surprised by this at all?
Well, at the very beginning, I was a little bit surprised because of the fact that when I initially started my training, I started at a VA hospital in Baltimore, Maryland, and I got some of the most superb training there. And I always liked working with veterans because I am a veteran. But later on, when I started working as a contractor for some of the veterans hospitals, I started seeing some of the improprieties that were going on. And I guess when I treat veterans or any patient, I try to treat every single patient like they're my own family member. And if you do something like that, you can't get into problems. However, it seemed as if in my own case, I would try to do top-notch care on some of my patients, and my hands were tied just because of some of the rules and what went on there.
Why would there be rules against giving a patient the best care they could possibly get, especially if they're veterans? I don't understand that.
Well, it's not necessarily rules. It's just sometimes I believe that government workers, because of the fact that the government insures these physicians and a lot of the healthcare workers, I believe that a lot of the times, because of the fact they're government insured and they're not carrying their own malpractice insurance. Like when I was a contractor at some of these facilities, I had to carry my own malpractice insurance. It's like I was doing private practice. But some of the physicians and some of the other people there, they didn't carry their own malpractice insurance. So it seemed as if they would let the government bear that burden, which is when I went in there, I wanted to make sure to give them the exact same care as I would give in a private facility or an academic institution.
What did you see in some of these hospitals? You worked in 4 different ones, and I know you've described some of the things that you saw.
Well, one of the cases in points is I went into a hospital on a Saturday morning. I didn't have to go in. I saw a post-op patient there, and what I saw just disturbed me because of the fact that one of the patients was screaming out in one of the rooms in pain, and he had surgery the night before, actually the day before, and he was not my patient. So before I get involved in a patient, it's not ethical to go overstep the other physician. So I started inquiring, and a nurse came over and she says, Dr. Greenlees, are you from anesthesia? And I said, yes, I am. She says, well, they've been trying to get a hold of the attending physician for this particular orthopedic surgery patient, and he's having some really bad pain. I said, well, how long has it been going on? She said, all night long. They shut the door and just writhing in pain. At that point, I said, you know what? I'm going to break protocol here. I'm going to go take care of this veteran. And so I went into the room and I said, listen, what's going on here? Well, come to find out, he was a heroin addict, and he was on methadone. And he was not told to bring his methadone with him. And I started looking at the pain orders that were written for this particular patient, and they were well beneath what he needed.
You also worked in some prisons. I'm just curious. Compare for me the difference between prison hospitals, VA hospitals. Who gets the better care?
Well, I trained at University of Texas Medical Branch, and we had a 7-story hospital prison there. And I've got to say, in some of the cases, I did see better care at the prison hospital than I actually did in the VA hospitals. Now, I can't just paint a wide band across all VA hospitals, but some of them were not up to the standard of care that they were even in prison hospitals. And I got to say, our prisoners are treated very, very well in Texas. Okay.
You know, that's disturbing, though, Gene. I appreciate very much the story. I think all of us are outraged when we think that it's happening in one location. But we're even more outraged if we think that it is a truly systemic problem across many of our VA hospitals. I know there are many good people who work in them, but there's something wrong when this many veterans are not getting the care and the quality that they have earned by virtue of their service. And I appreciate your being here to give us a little insight into it. Thank you very, very much.
Thank you for having me.
Coming up, one grandson's efforts to honor a grandfather he never met, and his fight to make sure that the men he served with get the honor they deserve.